Hi, good morning students. I wanted to make a very quick video on how to use the Ackley guide in regards to your care plans, one for your short nursing care plan that you've just turned in and for your future care plans throughout the program. The Ackley guide is made up of NANDA nursing diagnoses. These are diagnoses that nurses can do independent care interventions without needing an order. But there is also some interventions in here that are collaborative where you would need a physician's order. For example, it may say administer pain medication as ordered, and then it'll give you the evidence based on your intervention. I'm going to give you a sample patient where this patient has heart failure and there's evidence of swelling in their feet, and you identified this as their priority issue. So what you're going to do is you use your Ackley guide by first going to the green section, and that's this section right in the front. You can see the green. And I'm gonna go and look under heart failure, okay? So I'm gonna go to my H's. And again, the green is most likely the medical diagnosis, the priority problem that you've identified. So this is where you're gonna find the patient's medical diagnosis, and then you identify which nursing diagnosis is right for your patient. So, okay, in my book, I have heart failure under page 59. So I've identified heart failure as one of their medical diagnoses, and I've also identified that this is their biggest issue right now. I'm gonna look under heart failure and I'm gonna see what applies to the fact that they are now having swelling in their feet, and maybe I hear crackles in the lungs. That to me is showing that we have excessive fluid volume. So out of all of my possible nursing diagnosis under heart failure, I'm gonna then select for my nursing diagnosis, excess fluid volume. Then I'm going to find that nursing diagnosis in the main body of the book, and I do that very quickly by going to the index, and I'm going to find excess fluid volume, right? So the index says excess fluid volume is gonna be on page 413 for me in my edition. I then go to page 413, and here we go. I have the definition of what excess fluid volume means. I've got defining characteristics. So these are basically your signs and symptoms that you're seeing in your patient. I've got related factors. So that's my related to part of my nursing diagnosis. And then you've got associated conditions. And then you've got actual suggestions for goals that you could make. But again, these are the goals that are in the Ackley book where it says client outcomes. These are what you want to see in the patient for goals. You just need to add the time duration to it when you're making a SMART goal on your care plan, okay? And then you've also got all of your nursing interventions and rationales. When you're selecting which nursing intervention and rationale you want to do, a nursing intervention that can be done quickly, like within your shift. Always think of it as what can I do within my 12-hour shift when you're building your care plans for the patient to the hospital. So then you're going to select your appropriate intervention, and then you're going to write your rationale, which is basically what says EB or CEB, I think, for you guys in your new edition. That's your rationale for that intervention. So I said my nursing diagnosis is excess fluid volume. So when I write my nursing diagnosis, I have to have the three parts. I have to have the actual diagnosis, excess fluid volume, my related to, and then my as evidenced by, which is my signs and symptoms. So for this patient, I hypothetically said heart failure with swelling in the feet and legs. I'm gonna say excess fluid volume related to chronic heart failure, and maybe ineffective medication self-management, okay? So I'm saying what the etiology is. Why do they have excess fluid volume? And then my as evidenced by is their signs and symptoms. So in total, it would be excess fluid volume related to chronic heart failure, excessive sodium and water intake, ineffective medication self-management, as evidenced by bilateral swelling in feet. And possibly I'd also say as evidenced by auscultation of crackles and rales in the lungs, depending on what I found in my patient. Okay, so again, you need the three parts. You need the nursing diagnosis, You need the related to, which is the etiology. That's typically the medical diagnosis. Why is it happening? And then your signs and symptoms that you see in your patient, which is your as evidenced by. So one more time, succinctly, I'll make a quick one. Excessive fluid volume related to excess water intake, as evidenced by swelling in the feet and legs bilaterally. Okay? I also would suggest that you guys watch the videos that I'm going to attach to this announcement. And please, please, please read section 1 of the Ackley Guide, because that will help also. Thank you.